Okay, I'm going to say a good afternoon or a good morning or a good evening, depending on where you're joining from. I want to say first, thank you to everyone who attended our last webinar, which took place with Humanitas University in Milan. That was so well attended, some great questions, so much so that we couldn't get to every single question that was asked. So for those of you that came to that webinar, situation is more or less the same today. We're going to have a presentation and the Q&A feature is open at the bottom. For those that are joining us for the first time, whether it be here on Zoom or via Facebook, LinkedIn, or on YouTube, you can ask questions either through the Q&A feature at the bottom, as well as in the chat features on Facebook or on YouTube as well. Okay. So really, this is going to be a nice open session that we've got planned for everyone, irrespective of how you're following us today. So I'm going to first introduce myself. For those that don't know me, my name is Ben Ambrose, the Managing Director here at Medical Doorway. And we're really delighted to have with us today, and for some of the people are already asking questions, yes, the meeting, this actually is being live streamed on YouTube and Facebook. So for those that want to watch a repeat of today's presentation, you can do so on our Medical Doorways YouTube channel. So if today, during the presentation, you've got some questions, and I'm going to tell you how we're going to go about the session, please just tap them into the Q&A, which is at the bottom of the screen. Anything you say on the Q&A is anonymous. We're not going to divulge your name and the question you've asked, but please, if you do have a question, do make sure you tap it in, because if you don't tap it in, we can't deal with your question. And on the recording and on the replay, there are plenty of people who are going to be watching it who will have the same question that you guys have got as well. So I'm going to introduce Darren. Darren is the president of the LF1 Medsoc, which is the student society at the First Faculty of Medicine in Prague. And Darren came with us to Dubai in November last year, spoke to a lot of students there and gave his perspective as an international student and a student from the UAE to students and parents who attended our exhibition at the GEMS World Academy. And he's here for you today, not just as a student, but as the president of the organization, which has been set up many years ago to support international students through their studies at Charles University. And as a student himself, a fifth-year student, I believe now, Darren, yeah, he knows exactly what it is and what it takes to be a medical and dental student at not just in the First Faculty of Medicine, but in the Czech Republic generally, as well as being an international student, which carries with it a whole lot of baggage as well in terms of adjustment to life in medical school and in a new country. So more people are coming in. So what we're going to actually do is I'm going to pull up the PowerPoint presentation that we've got. Now, we're not going to spend too much time on the presentation. What we really want you guys to do is tap in your questions into the Q&A feature. That can be about anything. It can be about the courses. It can be about the entrance exams. It can be about the interviews. But I think as we've got Darren here, we really need to use that big brain he's got and try and the experience and make sure that we kind of extract all that information that he's acquired through his action learning project over the last 5 years at Charles First Faculty in Prague. So without any further ado, I am going to share my screen. I am going to start the presentation because I don't want to spend too much time on it. And as we go, if you have any questions or queries, please do remember to tap them into the Q&A and we will go with them. We'll go through everything at the end at the end of the presentation. And then I'll ask some questions to Darren because I've got plenty of questions that I want to pose to him as well. Not for my benefit, but for your benefit if you're too scared to ask those particular questions. So keep an eye out, the presentation's coming now. So everyone should see my PowerPoint. And away we go. I'm assuming, are you seeing the presenter view or the actual view? What can you see there, Darren?
I can see the presenter view.
Okay, so I need to make sure we change that. Let's make sure we change that around. Screen share, and that will be the one that you need to see. That's the one, isn't it?
Yes, that's perfect.
Is that perfect? Perfect. There we go. Right. So what we're going to do is talk a little bit about who we are at Medical Doorway. For those of you that many of you know us, a lot of the schools and school counsellors know us, but a little bit more about us and what we do. Then we're going to look at why we've been supporting students. And I've been supporting international medical students since 2011, and I've been supporting international students more generally since 2007. And then we're going to look at some university options, and we're going to look at the universities specifically today, those in the Czech Republic and Slovakia, the ones where we run entrance exams all across the world. And then we're going to focus very much on Charles' first faculty, because this is the university we get a lot of questions about, and it has a slightly different exam and interview strategy that I think we need to go over and talk about how we would prepare for that process, get ready for the interview. And then we're going to hand over in the kind of final half of the presentation to Darren, and we're going to talk about how the medical schools in Europe and the first faculty, about their approach to international education and medical education and why they are so well regarded all around the world. And then about how you would get through the course to where Darren is now as a fifth-year student, and then talk about the Med Society and talk about how that society supports you as medical students at Charles University. So our job at Medical Doorway is to listen to you. We're not here to tell you what to do. I mean, this is your decision. It's a huge investment that you're going to make, both in terms of time and in terms of finance. So we need to help you find the right medical school for you. And once we've done that, we will coordinate your application from start to finish. Now, we are running entrance exams all over the world now, just because of the demand from students, from parents, from schools, from school counsellors. We are actually now running exams for the Czech faculties and the Slovak faculties in London, like we have done for many years, but also in Hong Kong, Doha, Dubai, Sao Paulo, and this year, for the first time, we're running them in Berlin. And it's our job not just to run those exams, but to prepare you for those exams. And we do have a system which we'll show you later on in the presentation about how to prepare both for the entrance exams and how we would prepare you for the interviews. Because if these are exams that you've perhaps done for the first time, or you've never gone through the interview procedure, it's all going to be new to you, and every bit of information and every bit of support you can get along that process is going to benefit you directly. But not only that, once you've been admitted to med school, irrespective of whether you are an EU student or not, we work directly with embassies, and we've been working with embassies for quite a while in London, Hong Kong, also in Abu Dhabi, and in Doha, where I was in November last year, to help you get through the visa process. And Darren can testify that the visa process, once you've been accepted, is probably one of the more stressful and challenging things. And again, making sure that we are properly prepared in advance means that you will have your visa in hand by the time you're ready to enroll, and you will get into the country in plenty of time to make sure that we get all the other bureaucracy done before you have to start your medical studies. Because I say, when you start medical studies, it is like hitting a treadmill at full speed straight away. And Darren's smile on his face leads me to believe that I'm correct in that analogy. And I know it is, because when we start looking at the curriculum, you're going to see how jam-packed it actually is. But that's why the outcomes are so good. And then we will actually be with you when you arrive in country. I met Darren in September last year when he was talking to the brand new students, and he could see that myself, my team were there, as well as the parents of many of the students who we were supporting to enroll at university as well. Now, for those of you that have perhaps looked at the UK as a medical school, and that's the case for the vast majority of our British-based students, but also many of our students in Asia and the Middle East as well. Many have applied to the UK, and unfortunately, it is not getting any easier to get a place in the UK. The number of seats in the UK has not really increased significantly, despite of the government stating that they're planning to. But you are looking at about 7,100 seats, and anywhere between 24 to 30,000 applicants a year going for those seats. It peaked in 2022, not long after the COVID pandemic. It has reduced a little bit, but still, there are significantly more applicants today than there were, say, 6 or 7 years ago applying to medical school, with no comparable increase in the number of seats available. And that doesn't mean that we're overswamped with doctors, especially in the UK. In fact, the hospital I was born at has just recruited 3 new brand new junior doctors from the first faculty of medicine. One student was from Russia, one was from Dubai, and another one was a Brit. And that's just the hospital, one hospital in the northwest of England. There are many other hospitals across the UK that are bringing in larger numbers of students from across the faculties in the Czech Republic every year to fill up the vacancy positions that they've got. But what we've got to then do is find the right medical school for you. And that will depend on a number of factors, mainly your education and what you particularly want from a university. And as Darren can testify, Darren lives in Prague now. Prague is right for him, but Prague isn't going to be necessarily the right city for every single individual. Okay, it's a big city. It's busy. It's got various distractions. There are many other universities in different locations. And I say one of the driving factors of success at medical school isn't just the university, but in fact, the location and the environment in which you're in. And then obviously finance can be a big issue for many students. And we work with universities that have got various budgets. In fact, we're going to look at a variety today, just to show you that there are different opportunities depending on your financial situation. And the reason I say that's important is because on the whole, although there's one exception, the curriculum that you're going to study will be the same. I'm not going to dwell too much on this because this is really what we've got Darren, and Darren will talk to you about towards the end of the presentation about how he went through the course. But on the whole, Europe and the European programs, and those especially in the Czech Republic, adopt what's called a traditional medical curriculum. So the first 2 years being preclinical sciences, the next years being clinical sciences, where Darren is now in year 5, doing things like oncology, forensic medicine, etc. Eventually in your final year, which Darren will join in next September, where you do a full internship year, fully clinical, where you are doing your state exams, and then you get your license to practice medicine after completion of those exams. But before we get to those, we've got to get you through the entrance exams. Now, most of the entrance exams are now back in person. There are some exceptions, and we'll talk about that very, very soon. But you are going to be potentially able to take your exams, medical doorway exams, in London, Hong Kong, Dubai, Doha, Sao Paulo, Brazil. We've got the dates of those exams on another slide in a bit for Charles First faculty. But if you want more information, medicaldoorway.com, click on exams, and all of the exams, all the dates, all the locations are all there. You'll often find that the exams will form different subjects. So some universities have biology and chemistry and physics. Some have biology, chemistry, then a combination of maths and physics, or give you a choice between maths and physics. In other cases, it's just biology and chemistry. And many will follow up with an interview. Some are panel-based interviews. Some, in the case of First faculty, are MMI, multiple mini interviews. So we'll talk about how we've got to kind of get you through that procedure. But if we start with the First faculty, which is one of the most popular medical schools in Europe, in fact, it's the 11th oldest medical school in the world, or 10th oldest, I should say. This is where we run most of the exams. Most applicants apply for this, have to take an in-person exam. And yes, you can take them in Prague if you want, but why when you can take them in London, Dubai, Doha, Hong Kong, Sao Paulo, or Berlin at various points across the year? If you do apply for an exam and you're not eligible for it, it will give you an alternative option. But that's one of the faculties. In fact, there are 3 faculties of Charles University just in Prague. You've got the second faculty of medicine and the third faculty of medicine. Now, why are the 3 different faculties? It's chronology. So the first faculty of medicine was the oldest faculty, post-World War II. The second and then the third faculty were established. There is a bit more history about that, but it's probably not going to benefit you to know about that history, but just treat them as separate medical schools in the same city, which they come under the umbrella of Charles University. A little bit like the colleges of Oxford or Cambridge. You would study in one college, but you're studying in Oxford University or Cambridge University. Charles is an ancient university, just like Oxford or Cambridge, and is made up of different colleges. Now, I've kept the slide here on the third faculty because this is the faculty in the Czech Republic, which has a slightly different curriculum than I've talked about before. At third faculty, your curriculum will be integrated, PBL-style learning, more so than the other faculties in the Czech Republic and obviously the other faculties at Charles University. If you're the kind of person who would feel more comfortable with the integrated style curriculum, it's for some people, it's not for others because we all learn in different ways, then perhaps do some more research into the third faculty or get in touch with us and we'll be able to discuss the different faculties, the different approaches and try and find the right fit to you. But outside of Prague, we've also got Masaryk University in Brno, and we run those exams in London. For the Prague faculties, all of them, we're running them in London and Dubai, as well as in other cities for the first faculty. And then if you're a student who can't travel for whatever reason for an entrance exam, then we have Palacký University, which is the second oldest medical school, very close relationship with Charles First faculty, actually. A lot of the staff do know each other, and all of their exams are online, and we've got so many dates across the year. So there's a date that will fit you. And then for those that are perhaps on a slightly more of a budget, or those that want an entrance exam which just involves biology and chemistry and not maths or physics, Pavel Josef Safarik University in Slovakia are running exams in London, Dubai, and Berlin. And Ostrava University, which is the cheapest university in the Czech Republic at 11,000 euros, they also have exams in London. So what we've got there is just a sample of some of the universities that you can apply to in the Czech Republic and Slovakia. There are so many other ones out there. Do go to medicaldoorway.com if you want more information on them. And if you need any further detail or you've got any queries, you can just get in touch with us anytime and we'll be able to go through your specific circumstances and find the right options for you. So if we talk about First Faculty of Medicine, because this is the faculty which we're most interested in today. Yes, the 10th oldest medical school in the world, one of the most prestigious medical schools in Europe. It's got Californian accreditation. For those that are on from the US today or have US passports, it's US federal loan approved. So and we do have American students who are at the First Faculty on the federal loan, studying there, ready to go back to the US. In fact, Darren, do you remember Aaron from Hong Kong?
Darren Talk, who's doing anesthesia now. I think he's in anesthesia residency somewhere. Yeah.
Aaron was one of our students, and he graduated not last year, but the year before, in 2022. And he's now went through the USMLE and is doing anesthesiology residency at the St. Elizabeth Medical Center in Boston, Massachusetts. Now, for those that don't know how it works, going back to the USA to work, there is a list of priority, and the highest priority is obviously US passport holders. Aaron was a Hong Kong passport holder who didn't study at an American medical school, so he was kind of low down the list in terms of what they would consider eligibility for jobs in the US. But he was able to go into one of the most competitive residencies in the US, in Boston, Massachusetts, on the basis of his degree from Charles University. So it does actually matter to some degree where you go to university, especially if you want to work in somewhere like Boston, Massachusetts. There is a track record of success of some institutions over others. So if that's something which you're specifically focusing on, and I did mention briefly in the presentation before about accreditation, etc., please do get in touch with us, because if you've got a particular strategy in mind for your career, it does matter potentially where you go, and we'd help try and find the right fit. And that's the thing, the minute I mentioned the name, Darren knew everyone. And the reason for that is down to how Medsoc, we'll talk about Medsoc, how Medsoc works, because you are one big family. Irrespective of whether you go to the First Faculty or Masaryk or Pulaski, you'll find that you become a family of professionals, and you'll then know how each other's got on in their careers and stay connected for many years to come. So how do we get into the First Faculty of Medicine? Well, it's not easy, I do have to tell you. It is not a simple procedure. There are a few hoops to jump through, but if you manage them appropriately and you plan in advance, you will be able to maximize your chances of getting a seat. This year, like I said, for the First Faculty, we've got exams running from March in Brazil, in April in the Middle East, right through to the UK, and then in Asia in May, back into Europe in June, and potentially, if there are any seats available, there will be a clearing exam in August in London, if there are seats available. So for the moment, if you're based in Europe and you want to take it in Berlin, we can register you for that exam. If you want to travel to London, we can register you there. Alternatively, we have the exam centres in the Middle East, both Doha and Dubai, as well as Hong Kong. But irrespective of where you take the exam, you will be taking the same type of exam. Not identical exam, you're not going to find the same questions popping up in every single exam, obviously, but you will have a multiple choice exam. Biology, chemistry, and physics. And it's a relatively short exam, 90 minutes long. Okay, so it's 25 questions in biology, 25 questions in chemistry, 25 questions in physics. And it's pass-fail. So there is a pass mark, but the university keeps that pass mark to itself because it's based on an algorithm. And if you pass the exam, you'll then move forward to the next stage. Now, you might say, okay, it's a multiple choice exam. I don't take physics, or I'm concerned about the level of chemistry. How am I going to know what to expect? Well, in a moment, we're going to just show you the system that we've set up, which we provide free of charge to our students to help them get ready for the exams. If you are lucky enough to get through the exam, it's pass-fail, you're over the hurdle, that job is done. If you do pass the exam, you're going to move forward to the interview stage. And in the case of First Faculty, the interview is what matters at that stage to get you admitted. And this changed last 2 years ago, and other faculties, they'll put together your exam result and your interview result together, But for the first faculty, they do what's called an MMI, multiple mini interview. For those that have applied to the UK, you may have already had an MMI or may have been preparing for MMIs. For those that perhaps haven't gone down the UK medical school application route, this might be new to you. And if it's new to you, yes, we do need to prepare you for it, because it's not a simple panel-based interview to find out more about you. It will pose you some pretty challenging questions, some of which might not seem at face value to make much sense. But it's there to determine your level of interpersonal skills, as well as your ability to analyze a situation. And even if you don't know the answer, because in some of the questions, there are no answers, there is no viable, accurate answer that you can provide, but it's there to see if you can at least formulate a method by which you could find out that answer. And that's critically important going into medicine. You are a problem solver. You are going to be someone who takes in multiple different pieces of information to come out with a diagnosis, or at least a set of questions that you then need to answer, which you might have to answer by ordering certain investigations or delegating to another professional, or even asking someone senior for their opinion. This is 4 stations, and this bit is done online. So the exam is in person in those exam centres. Usually a week to 2 weeks later, the interview will take place, and 2 days after the interview, you do find out if you've been accepted into Charles' first faculty or not, and at that point, the offer's unconditional. But we need to get you ready for this MMI. So what we do for all of our applicants, in addition to the preparation system, which is free of charge, we also will then do live Zoom preparation to get you ready for an MMI. I used to work in a UK university with its own medical school. I'm a physiotherapist by background. I have been involved in MMIs at various stages, so I can come at it from an informed basis. And I said, we will do what we can to prepare you. You've just got to engage with that. But if you do engage with the online learning system, and you do engage with the interview preparation, then that will maximize your chances of getting a seat at the medical school. It's not going to guarantee anything. No one can guarantee you a seat at a prestigious, illustrious medical school like Charles' first faculty. In fact, if you've not got what it takes, even through the preparation we give you, you won't get an offer. Our job is to help you refine your knowledge, refine your skills, so you're at the best fit for the exam and for the interview, so it can maximize your attributes to get through that exam. And what we're going to do in a short while is we're going to show you the preparation system. But what I want to do right now is hand over to Darren, because Darren is why we're here. I don't want to talk for much longer than the 25 minutes I've spoken already, and that was bang on time for me. So what I want to ask Darren, really, before we get into some of the questions, okay, is Darren, tell us about, we talked about the curriculum. Can you just talk us through, like, you arrived in Charles University, 5 years ago, or 5.5 years ago coming up now. Yeah. What was your first year like? What was it like in terms of teaching? How did you actually get through it?
Amazing. Well, first I want to say thank you for having me on this call, Mr. Benjamin. To everyone that I'm meeting for the first time, my name is Darren. I'm a 5th year medical student at Charles' First Faculty of Medicine. I also work as president of our student organization, LF1 Medsoc. We'll probably dive into it in a little bit. I also am sort of a part employee with the university. I'm a teaching assistant for physiology, so I've been teaching with them for the last 3 years. And we have this beautiful physiology training center, which we can also talk about, which is really, we have a lot of different professors and scientists from across the world that come to learn from this simulation center, which you guys, if you will come to our faculty, will already be able to study and learn at this faculty from your 2nd year onwards. Well, when I arrived in Prague, in my first year, it was actually my first time even in Prague. So I was lost. I didn't speak the language. I didn't know how to get around. But luckily enough for me, when I stepped into the Dean's building, we had Medsoc. So Medsoc is medical society. It's basically every medical school has their own medical society, and ours is Charles' First Faculty of Medicine Medical Society. We've existed for about 25 years. We were started by our current Vice Dean, who is Dr. Aitan Brisman, who we work with on a weekly basis, as well as with our Dean. And Medsoc generally has many different branches. We have an academic affairs, where we have workshops for you. So all the way from your 1st year to your 6th year, Generally, we'll train you guys with your anatomy, with your physiology. We'll have workshops, we'll have mock tests, we'll have practice exams for you guys. We also have a student support team, and in this team, we take care of your mental health and fitness. And we also have the student guides, which are extremely, extremely important and vital part of our faculty and of Medsoc. I began as a student guide myself in my second year, and I progressed to the head of guides and the head of student support last year. But the student guides are senior students that are going to stay with you from the first day you enter your faculty to the last day of your first year. And of course, when you have created these acquaintances with many of these student guides, they will be with you throughout your medical school journey. I apologize if you hear some drilling. My neighbors have just moved in and they're putting up their photo frames, I think, at this point. So we have student guides who are going to stay with you all the way from when you enter the faculty, how to open a bank account, what documents to submit to the visa office, how to register your arrival into the Czech Republic. They train you with your initial winter exam periods, with your dissections, with your final anatomy exams, with doing your retest, with, really they cover the entire aspect of a student journey that you need. And this is something that we generally saw a gap in with students. When you join a medical faculty, you're generally quite lost. How do I sign up for an exam? How do I learn the language? I don't know Czech. How do I, order something from the supermarket? So obviously a lot of these things are very overwhelming for someone that's just entered a new country. So we've created a system that's going to take care of you and cater to your needs. Again, our system has about 26 different nationalities in our team. And generally, we take care of anyone from different backgrounds, different religions and cultures. And we try to create this big family here at Charles First Faculty of Medicine. But really, we're here for you. And to go back to your original question, yes, first year is definitely difficult if you didn't have the support system that we've created here for all of you. But today, if you are to join Charles First Faculty of Medicine, we really have students that are here and professors that are here to cater to your needs and take care of you along this journey in medical school.
Yeah, and what's great is some of the questions. What I'm going to do is I'm going to address some of the questions that have been answered, Darren, in that conversation that we've had. You talked about the language barrier when you arrived. Now, just for everyone to be clear, the degree is taught in English. So at Charles First Faculty, they'll have a degree in medicine and a degree in dentistry taught in Czech for the local students. That's mainly Czech and Slovak students who study in the local language. They have a parallel degree in English, both in medicine and dentistry. So effectively 4 degrees. Now, they're called parallels because they're identical in every single way. It's just that the language they're taught in is different. But obviously, you living in another country, learning the language is part of that. So, and the university does have language lessons, language tuition, at least for the first 3 years, on how to speak the local language to a conversational level. People have asked that question in the Q&A already. So you had your Czech language lessons for the first few years. What level do you believe you kind of got to in that? And how do you believe you've kind of engaged with the language in that period of time? And how long did it take you to pick up the language to get to that kind of general conversational level?
Perfect. So I think it will take you about 6 months generally to start to pick up the language a little bit. But our faculty, it's included as part of your course where we train you in a stepwise manner towards the Czech language. So we train you for your first 3 years in your preclinical years in the Czech language. So 1.5 years, we train you with general Czech. That allows me to order something at a restaurant, to have a basic conversation with someone on the street or with any professor. But again, as we've mentioned, the whole degree is in English. And the other 1.5 years is a mix of general as well as medical Czech, because we want to train you a little bit on some parts of the body in Czech, and this will help you when you deal with patients in your clinical years. But let me just say one thing, and I want to reiterate Mr. Benjamin's point, that you don't need to speak a word of Czech in the 6 years that you're here. The entire degree is in English. You're going to be taught in English. The professors speak to you in English. You submit your essays in English. The Czech is to supplement your education here. It's to supplement your clinical experience here. and it's to help you really get around to really get around the Czech Republic as well as Prague. It's very useful to learn a language whenever you're in that particular country, but in our faculty, if you don't necessarily pick up the language, like for me, I'm not necessarily a language person. I only speak English. So for me, I don't speak a lot of Czech, but I'm getting through the years very well, and I haven't necessarily faced any particular difficulty. But yes, the Czech course is included, the Czech language course is included. And you can pick up some basic as well as some medical Czech that you can converse with some Czech locals as well. So.
And I think you also get to know at least some of the local students, don't you, on the local program? Because many of those Czech nationals and Slovak nationals who are still in the local program, they want to improve their English at the same time because they want to go and have the same opportunities to work in the US. For those that didn't know, the USA's first ever face transplant was performed by a Czech surgeon. Didn't go to Charles, but still, he actually went from the Czech Republic in the early 90s to the US and went on to lead the USA's first ever face transplant. Fantastic TED talk on YouTube from him as well. Bohdan Palmahatch was his name. So yeah, so you will find that level of engagement. Darren, how do you find the Czech Republic as a country in terms of welcoming you? Because you come obviously from Dubai, you're of Indian origin. You're going as a student that doesn't have, you're not a 6-foot blonde handball player. Okay, how did you find Prague as a city in terms of kind of adjustment?
Well, generally, I think I fit pretty well into this city. I think when you join our medical faculty or really our university, everyone's sort of welcoming. You have a lot of senior students that are there to help you out, and generally in the medical field, the idea is that we learn from our seniors and then we teach our juniors. So everyone has this sort of idea and mentality in our university that we want to help our neighbors, we want to help our juniors, we want to help anyone that we could particularly help. So in that sort of setting, I really found myself being able to engage with different people because everyone's international in that sense. To talk to the Czech parallel who obviously want to learn about our variety, mixed different cultures. So I generally found being able to adapt to the city very well. And I was happy just like I am now. So.
Yeah. As I said, there are quite a lot of questions coming in now. We will go through them, and what we're going to do is rather than answer necessarily all of them directly, we'll try and answer a few of them together in themes as well, because that will allow us to even cover more content. We've talked about the teaching, we've talked about that, we've talked about the Czech language and how that prepares you for the clinical environment, because you're always going to be supervised, you'll always got a tutor with you who's bilingual. Many of the patients actually also speak English as well as to a level which does help you get by. Before you get there, especially in those first years, you're going to have exams. Now, a lot of people do get confused about the Czech exam system because it's actually quite different than how we would do things in the UK. So for those that don't know, in the UK, if you're, say, studying at med school, you will be given an exam date on a particular day. Anatomy at this time on this day. Darren, can you talk us through the different exam strategies they have at Prague and more generally the exam strategy they have in Czech Republic and Slovakia and Europe? Because you'll have things called credit exams. Then your final exams that you take for modules, it's up to you when you sit them, isn't it? Can you talk about how that works and how do you feel the best strategy is to make sure you progress through those exams kind of as, bruiseless as possible, yeah? With least possible issues.
Absolutely. So to give you a basic introduction on the structure before I dive into the exams themselves, we have a 6-year program. The first 3 years are preclinical and 4th, 5th, and 6th year clinical years. In your first year, which a lot of you are entering, you're going to study anatomy and histology, which are your 2 main subjects, and you have a few other smaller subjects like Czech, like Latin, medical terminology, biophysics, which is going to help you learn about MRI machines and X-rays and whatnot. But the 2 main subjects you're going to have in first year is anatomy and histology. So in your first year, we really want to teach you where everything is in the body. Anatomy is macroscopically and histology is microscopically where everything is. I might study about the brain in anatomy, but I might really look under the different sections or slides of the brain in my histology classes. My second year is more physiology and biochemistry. So this is where I learn about how everything works in the body. I've already studied in first year where everything is. So my second year, how everything works. My third year is pathology, where it's what happens when things go wrong. So it's all the different diseases. And my clinical years are generally practicing all of this information, particularly in every department. Our university, we generally do the main final exams are generally oral exams. So to be able to pass your final oral exams, you will have many different stages to it. But the final exam themselves, the last part can be an oral part, or most probably will be an oral part. We find this extremely beneficial in order to train our students for practice, because really you're never going to have a patient that's going to ask you to write a 2-page essay on their disease. They're going to ask you to explain to them, how did I get this disease? How do I manage it? And what's my treatment for it? So this is really what we focus on. We have oral exams, but you might have a few parts before that, such as an ECG part, such as an MCQ part, but really the final part is your oral exam, where we really feel that this is more progressive, or really how we should be training our doctors. The best way to, and of course, the credit exams themselves, we have 2 semesters. We have a winter semester and a summer semester. So during your weekly class, let me take you through anatomy, for example. You will have a slide test, or you will have a practical test. So you might have a different part of the body that's brought to you, maybe the upper limb, and your professor, your anatomy professor, will point to that different part of the body and ask you to name it. And this will be in your weekly test. When your final exam, you might have to pick up, a placard of 3 questions, and you have to answer on these 3 questions orally, as well as there is a practical part to this exam as well. So initially, you have to be able to pass your different tests during the year to achieve the credit. And once you have the credit, you can then attempt the final exam. Every final exam has 3 tries to it, right? And again, it's not necessarily easy to pass in your first attempt, but it's not impossible either. For example, I haven't failed an exam in the last 5 years that I've been here, but we have people that have failed in their first attempt and they're very successful in their second attempt. It doesn't mean anything. It's just that we want you to be as well as you can in that particular topic, as well as you can in anatomy and histology. That's why we give you another attempt to revise a little bit of it and then come back and do your second attempt. Even if you don't clear in your second attempt, we have another attempt for you. So there's always possibilities. And even if you don't clear your 3 attempts, you get 3 attempts the next year if you were to postpone that subject under certain circumstances. So really our exam system is trying to prepare you for your clinical years as a future practitioner, in which you're able to converse with patients, in which you're able to recall information or large chunks of information very quickly, and to deal with professionals, because the way that you're going to talk to doctors and your patients as well is going to be different. So the way that we explain our topics to our examiner is going to be different in our anatomy class versus our bioethics class, for example. So this trains us in many different ways and qualities, I will say. But yes, the basic structure is an oral exam for your final exams. And again, in terms of preparation, you have to be well versed and follow along. I think the one main tip I tell a lot of medical students, and you've probably heard me say this, Mr. Benjamin, when you came to Prague last September, and I was talking to a lot of these medical students, is that medicine is a marathon. It's not a sprint. So essentially, if you're consistent, consistency is really the key. If you're consistent, you will be able to pass all of these years without any sort of issue. If you're taking your anatomy test and your histology test very seriously on a weekly basis, your final exam is not going to be something that's extraordinary, I would say. So just be consistent. And when you enter, you don't have to put everything or all of the pressure at once, but if you really plan it out and space out your studying schedule, it's not impossible at all. You will do extremely, extremely well in medicine. You will do extremely well at our faculty.
It's about planning, isn't it? And I think that
Absolutely.
I think I'm going to pull together the entrance exam and the exams at the university. If you're trying to cram so much knowledge in at the very last opportunity, it's not going to happen. You can't learn anatomy in a week. Anatomy is learned over a very long period of time by taking in small amounts of information. You can't learn the upper limb and the lower limb and the neurological system and the vascular system in one go. You have to break them down and then put them back together again. That's called analysis and synthesis. And that's the kind of approach you need. And so for the students that we find and we speak to who are being very successful, like yourself, Darren, even those who fail the first attempt, and I'm going to talk a little bit more about that in a moment, it's about how strategically you prepare your studies, not about can you balance both? And you need to have a social life. You need to be able to come away and relax, but can you space out and balance your studies and get into a routine? It's like being on a treadmill, isn't it? Running 10K on a treadmill. Once you're into a routine, once you're at a certain pace, a certain beat, it's easier to keep going than if you're trying to stop and start, stop and start, stop and start. The other thing I'll say as well is that, yeah, we do come across students who fail their first attempt. And what I think, and I think this is a superior aspect of what they do in the Czech Republic, is that the second attempt, as you said, students can do very well in the second attempt. In the UK, you'd often be capped at the lowest possible mark. In the Czech Republic, you could still get top marks in the second attempt, even if you failed the first attempt, because they're testing what's in your head at that particular moment. And sometimes students just do not pitch it right for that first attempt, but they learn from that failure. And that's what failure is all about, learning, and then build on that and have a more successful second attempt. I think you've probably seen students who've done that all the time, Darren, haven't you, or colleagues of yours?
Absolutely. And sometimes I can tell you that some of the students who pass in their second or third attempt do have a better knowledge than some of the students that pass in their first, because they've revised it over and over. So
Yeah.
I would say that that system generally does work. And again, to mention one of your points, we don't have a set number of limit of students that can get an A or a B in their exams.
Okay.
Everyone can get an A in their exams. So everyone, and that also sets them up for certain scholarships that we do have in our faculty, which maybe we will get into shortly. But again, everyone can get an A for their exams. There isn't any cap on the number of students that can get an A, essentially. So
yeah, no, it's what's called criterion reference. So everyone can excel, everyone can struggle. You know, it's done to employ you or to assess you as an individual, unlike the French system, which doesn't work like that way at all. Okay, we're going to come back to you, Darren, in a minute. What I'm going to do for now, if that's everyone, I'm going to break this up a little bit. So for those who've asked about preparation for the exam, both in the entrance exam, my advice is the earlier you prepare, the better. And what we've done at Medical Doorway for the years that we've been working with the Charles First faculty and other faculties is we've set up a system that we call Check Test Prep. And it's something that we've designed specifically, and I'm going to expand this window for you now, if you can all see this window. I'm assuming you can all see the Check Test Prep system. Am I correct there? Yeah? Darren, can you give me a nod if you can see that? Yeah? Yep, good. So this system here we designed, and for example, for everyone who's particularly scared about physics, so all of the Medical Doorway applicants get access to this free of charge. And what we've developed in here is an entire system of lectures to go through perhaps areas that you necessarily wouldn't have covered after you take GCSE physics. This does go over and above what you would need. And for example, so we've got different lectures on liquids, for example, which you can watch. These are narrated PowerPoints. And these tend to last, as you can see here, about 25 minutes. It's bite-sized. It doesn't replace your A-levels. It doesn't replace what you've done. What I would say is if you've taken maths at A-level, that does give you a good foundation. If you've done physics, even better. But it doesn't mean that you're going to be at a disadvantage for the exam if you haven't taken physics, because the exam is an amalgamation of biology, chemistry, and physics put together. Going through this will help to refine and boost your knowledge. In addition, we've been working on some new sample questions for the first faculty. So what we've got here is a system where we have multiple choice papers, multiple choice questions, one correct answer as per the exam. And then you can, I'm not specifically choosing the correct answers here, I'm just choosing any answer. So don't please judge me on my lack of physics knowledge, everyone. But you can actually then go through this here, test yourself at the end, get answers to the questions, so you can actually try to figure out how well you're doing. And many of these questions have come directly from the first faculty's Czech question bank and have been translated into English. So these are going to be fantastic ways that you can at least do some preparation to prepare you more for the entrance exam. And the benefit there is once you've registered for the Medical Doorway exams, we don't charge for that. It's not our business to make money from you sitting exams and preparing, okay? We could do if we wanted, but that's not our ethical approach to helping you get into medical school. Our idea is to prepare you adequately so you've got the best chance of getting in. We are directly funded by the universities. Darren, how did you prepare? Because I think you did A-levels, didn't you, Darren, when you went to school?
Yes, exactly. I did A-levels.
Someone asked that question. How did you go about the actual entrance exam, preparing for it?
Amazing. So firstly, I want to say I didn't have the same support. I was super impressed with what you just showed me because 5 years ago, we didn't have necessarily an agencies that were willing to help us to this extent. Um, the visa wasn't very easy to apply for. Getting through all of the documentation for the entrance exams alone without an agency like Medical Doorway seemed to be very difficult. And of course, trying to arrange it, with the faculty themselves. So I think you guys are doing an awesome job with that. Which is again, guys, I'm being completely honest because Medical Doorway is I'm not sponsored by them in any way, so I'm here being 100% honest. That you
Not a
guys are
medical
doing.
doorway student, Darren, actually. So that's the thing.
Yeah. But that's amazing. So how did I study for the exam? So I went to the faculty website and I looked at the entrance exam, different preparation resources that they recommended. And I mainly use those resources. I put a big focus on my chemistry, I would say, because generally I found the resources they provided were quite similar to the chemistry questions. With physics, they were quite similar to A-level physics, so I mainly focused on the formulas and some basic physical aspects. But the physics wasn't too difficult. The biology, I would say, was very broad though, because biology is a huge course. We're not only the biology part of the exam wasn't only focusing on anatomy or on medical biology. So the biology part was broad. So try to read as much as you can. Try to use this advanced biology for you textbook, but again, focus on what the faculty has given on the website. But I will say that the chemistry and physics part were easier to score a higher grade in. The A levels helped me a lot for that physics and chemistry part. For biology, I did have to read a little bit outside my A level course. I would say that.
Yeah, we've actually developing the biology section now. We've actually just been putting in a lot of new content on there, and there are going to be a number of questions going on the test prep system as well over the next month to get students prepared for that. It's something we're constantly evolving as the application system changes. Okay, right, Darren. Someone's asked another question. I'm going to change tact completely now, if that's okay, and we'll try and keep it to about an hour if that's okay, because I know you are busy because you've been doing exams recently. Did you do anesthesiology just yesterday or the day before?
Just yesterday, yeah. I had my anesthesia and emergency medicine, but it was generally okay. It was a good exam, and yeah, I can't complain.
Okay, so I've just lost the question that we were going to look at then. Yeah, so basically, when you qualify from Charles, your degree is automatically recognised across the whole European Union, still is the UK as well. And obviously, you've got recognition across the whole United States, including California. Yes, you do have to take the USMLE. What's your plan, Darren? Because you're getting to that stage in your career, in your studies now, you're thinking about what happens after Charles. So what's your plan? What have you and has that changed as you've gone through the course?
Definitely. So it's a great question. I feel it's a very, very important question because a lot of us think about how to get into medical school, and sometimes we should also consider what's our opportunities after. So I'm happy to be in to be in Charles First Faculty of Medicine, or to be in a platform where they're accepted really all across the world. My plan is I do have my specialty, which I like. I do have certain goals that I'm aiming for, but I am applying everywhere. I am doing the USMLE. I'll do the USMLE in a few months. I will be applying to the UK. I will be applying to Canada and Australia as well. And I wouldn't say I personally will be applying to other European countries because again, I only speak English. But if you are fluent with any of these, with German, for example, we have a lot of our students who can speak German have a direct pathway into the top German hospitals as well, or while you're studying
German speakers, we've got the scholarship system now as well, where they're fully funded, and we're actually doing the exams in Berlin. So if you're a German speaker on everyone, you can there are some scholarships available to fully fund your studies, which is a fantastic development.
Absolutely. So essentially my goal, I'm quite interested in cardiology, and I really like a particular field in cardiology called interventional cardiology, where you are really just placing stents into people's heart. It's a very non-invasive compared to cardiac surgery, but I do like the surgical field as well. I'm applying to the UK, I'm applying to the NHS, and to be able to know that my degree is valid in the US and Canada and in across Europe, of course, in the Czech Republic as well, is very, it's a great feeling because I have that opportunity to sort of apply anywhere I would like to. I am focusing on UK, I'm focusing on the NHS. I know a lot of our students do graduate and head to the NHS. They do head to the US, and we did mention Aaron as well, or to some European countries. So really the opportunities are endless. As long as you're interested in a particular country, in a particular specialty, you can really apply to that from here. And while you're also a medical student in our faculty, we do have partnership universities where you can go and intern in different countries. So if you don't know how the system works in the UK, if you've never been to the UK or you haven't worked in the NHS or been a patient in the hospital to know how it works, you can go with one of our partner organizations, our partner universities, and do an internship for a few weeks and understand how the system works, and then base your decision off that. We have these clerkships in your second, third, fourth year. I know we had a few questions about that as well, and we can dive into a little bit about that. But yeah, the degree itself is accepted everywhere, and my personal goal is probably the UK or US.
Yeah. And you say you've been prepared. There's a question about USMLE, so I'll just deal with that one while we're talking about how have you been preparing for the USMLE?
Okay, so to any incoming students, I will tell you that it is rather early to think about USMLE, because the USMLE is majority a preclinical exam, right? So it will you really have to have a good knowledge of your anatomy, your pathology, your pharmacology as well. So I would say that these three subjects are extremely important for the USMLE. How am I preparing for it? It takes about 6 months to a year to read from scratch to really start for this exam. I've generally got a head start essentially because a lot of the courses, a lot of the teaching that's been there in our university is sort of the same teaching that the same knowledge that I need for the USMLE. So I have a little head start in my pharmacology especially. But I'm starting with the basic preclinical sciences, and I'm just practicing a lot of questions with different Q banks online. We do have our student organization that has workshops with Kaplan directly. So these are big publishers in the US that take care of USMLE. So we have discounted courses as well as workshops by them directly for our students who are interested in the USMLE. And we do have our students like Aaron who come down, our seniors who are working in different hospitals in the US. We also have another one named Jose, who graduated from Charles First Faculty of Medicine, and he was doing a research fellowship in plastic and reconstructive surgery in Harvard. So he also comes down and gives certain talks for our students on how to get publications and how to get accepted into these universities and how to, again, start from scratch and structure your studying plan for the USMLE. So this is essentially
the big strength I just spotted there is these are former Charles First Faculty students coming back to support existing Charles out the goodness of their heart. They're not paid for it. That's the kind of family that they kind of build, the level of ownership or belonging that people often feel to the First Faculty, as well as other faculties across Czech Republic as well. And I think once you've got a large faculty like First Faculty, and someone asked a question before, there are about 150 medical seats a year and about 40 dentistry seats a year on the English program. That's actually a large group of people that are graduating every year and coming back to support those students. And like you knew Aaron straight away when I mentioned the name. People, when we do this webinar in say 2 or 3 years' time, people will remember Darren, as well as those other students. Someone asked a fantastic question, and I'm going to change slightly. Someone asked about how confident the professors are in English, because some people get an idea that the professors in the universities are going to struggle with English. In fact, for those that don't know, the Vice Dean himself of the English program is British. So it's Professor Brisbane, is a British surgeon who's now the Vice Dean at Prague. But all of the professors I've met in all of my time are just as good as English as myself or Darren, and mainly because they have to publish their research in English. And just knowing Czech is not a way to develop things forward in terms of your research, etc. But how have you found your engagement with the professors over the last, say, 5 years?
I think that was a great point that you gave. Yes, almost all of the research, or really all of the research, is published in English. So, and the English that they're published in, I guarantee you, if you haven't been through a few years in medical school, you wouldn't understand a word of it. But it's great English. You know, it's just that it's in this medical jargon that's above above our head. Well, it's not mine. I can understand it now that I'm in my fifth year. But yes, their English is generally quite good. You do have you know these professors that have to undertake different courses or different qualifications in order to be able to teach our parallel. And most of the doctors in the Czech Republic who aren't professors, essentially even teaching in our faculty, they do speak English. I think it's just a given because in our profession, we don't always stick in one country and specialize. We like to travel. I personally, even last summer, I was traveling to different hospitals in Dubai, in India, and in the UK as well. So in our field, we like to travel to new countries to observe new systems, to look at new advances and new technology. So it's really not impossible if these professors were to only speak Czech. And a lot of them do have qualifications abroad, research abroad, collaborations with other European and US medical centers for research. And actually, even bigger than medicine, our faculty is quite big on research. Actually, this is why we're really on top.
Mm.
So yeah, I don't see any problem with the professors themselves and their English. They do speak English, and again, all of the students in your parallel are international students that speak English just like you.
Okay, fantastic. Right, talk a bit about accommodation and things and how you've done that, because people are asking questions about the dorms or about apartments. I think you probably moved into the dorms when you first arrived in Prague. That's quite normal to do that. But how have you found the living arrangements in Prague as a city as well as the university?
So I will say that you have something in Prague for everyone's budget. I will say that. The dorms are extremely budget friendly. So if you were to pay 150 to 200 euros a month, you would, or if you have this as your budget, there is something in the dorms that will fit this budget and you're able to stay comfortably. You might have a little bit of a journey for 20 minutes to the center, but our transportation system here in the Czech Republic is like no other. It's extremely good. And you pay a very small amount for an unlimited pass on your trams, metros, and buses. So the dorms are extremely budget friendly and they're located in different parts of the city. And there you could also meet students that don't only study medicine, but are from the other Charles University faculties, which is really great to expand your international circle. You do have private accommodation. So something you need to know is that Prague as a city is divided into 22 zones. So it's Prague 1 to Prague 22 or 24, I believe. Where Prague 1 is the old town, and a lot of the university buildings is located in Prague 2, right? So we have many different Charles University faculty buildings because they're historical, right? Your anatomy is not in the same classroom that you will study histology or the same classroom you study pharmacology. Your anatomy has its own building, right? So in this building, you have your anatomy professors that will only teach you anatomy and in their free time conduct research in anatomy, which also has a beautiful museum that's only open to the medical students and on one day open to the public. Your pharmacology has your own pharmacology building, right? So to move back to the dorms, you have plenty of room in Prague too, right next to your faculty. I lived in Prague too for the longest time. And I paid about 500 to 800 euros a month. So again, the dorms will take you 150, 200 euros. And again, I know everyone's joining from different parts of the world. That's what I'm telling you guys, the cost in euros. Of course, here we deal with Czech crowns. And in Prague too, you'll find something between 500 to 800 euros. That's where I stayed for a majority of my stay. And I was able to walk 5 minutes and reach my anatomy class or the dean's building. Now I stay a little bit away from the center because I liked a little bit more quiet, a little bit more peace, and I like the different cycling lanes and area that I'm in now. So I stay in Prague 4 now, but it takes me 11 minutes by tram, which is the tram stops right in front of my house. It takes me 11 minutes to get to my dean's building. So wherever you stay, you have a budget for your pocket essentially, and you have means that is affordable, cheap, unlimited to reach the different faculty buildings that you have to.
Talk us about how much do you pay for the travel permit for the year for Prague?
So I paid 1,200 crowns, which in dirhams is 200 dirhams, and that's
about 50. That's 200 dirhams is about 50 pounds, isn't it?
I would say 50 pounds, 40
for
pounds.
The whole year, yeah.
For the whole year, and to be very honest, when you pay 10 dirhams for each ride, or I don't know, 10 dirhams a day for your metro travel, this is like a month of travel in Dubai or 2 weeks of travel in Dubai by metro compared to a year of unlimited travel, by the way, unlimited travel across the
Mm,
entire city. So, and again, if I wanted to go to a different city in Europe from Prague, because we're really in the center,
yeah,
I'm paying just a few hundred dirhams, or I'm paying 200 euros to fly to Paris, to fly to Amsterdam, to fly to my sister in the other end of Germany. So it's really, in terms of transport and availability and cost, it's very, very budget friendly.
yeah, yeah, yeah. Okay, so I'm going to quickly look at some of the questions, and then I'm going to talk about how we apply, because we have just hit the 1 hour mark. I don't want to keep Darren too long, although I know he's very happy to give up his time. So Prague can be a very cheap city to live, as we've said. I'm just dealing with some of those questions there. And the university does have accommodation. Okay. Okay, so you found how modern have you found the hospitals? Because that's quite interesting. How have you found the clinical experience? Because I've been into Czech hospitals and I find them ultra modern across the board. In fact, embarrassing some of the UK hospitals actually. Because someone's asked a question about what are the hospitals like? Are they actually modern? What can you just correct us on that one, Darren?
So absolutely, they are modern,
Yeah.
and you're definitely going to see a wide range of so our university, being the oldest, most prestigious faculty, and I don't know if a lot of people know that the second and the third faculty was also created later on to supplement the need of the students that come into first faculty. But we don't only focus on one hospital, right? So we have our general teaching hospital. And in this, we have, I would say, 20 to 30 different departments, which again have their own their own sort of buildings for them. We work with other hospitals such as Motol, with
Yeah.
Military Hospital, with Bulovka, Tomai. There are at least 8 hospitals in Prague. And when I say hospital, these are huge, by the way. The hospitals here are
Mm.
extremely huge that we have at IChem. This performs one of the most kidney and heart transplants in Europe, right? So we have at Motol Hospital, we have the largest lung transplant department in the region. So we have generally patients that come from all across Europe to this hospital to get lung transplants, and we've had our courses and our clinical experience in every single one of these hospitals. So I'm not only working in one hospital here in Prague, I'm working in 7 or 8 different hospitals, which means I'm working in hundreds of different departments in different settings. I'm working in clinics, and as well as we have some field work or simulation centers that can supplement our teaching. But really, the hospital experience, you get everything from the most equipped hospital, such as Military Hospital or ICAM, and you can get other hospitals such as clinics that do day-to-day outpatient care. So you get that whole experience that you really need as a medical professional to know what field do you like and what field you wanna focus on later in your career. So you have that complete circle, I would say, of clinical experience here.
Okay, so brilliant. Now, a little bit about someone's asked about how the Czechs have been welcoming to you. Can you talk a bit about how you've engaged with the local society there before we're going to give it 10 more guys, 10 more questions, 10 more minutes, I should say. We'll end at about 1:15. So, can you tell us a little bit more of how the locals have adapted to having so many international students around?
So I can definitely say that the younger generation are very welcoming. The Czech parallel is extremely welcoming. In our second year, and I know you mentioned this, that the Czech students would like to learn about the English culture and vice versa. In our second year during our Czech program, we actually have an exchange program. So this is compulsory for all students. So we connect an English parallel student or an international student with a Czech student, and you basically solve worksheets in Czech, and the Czech your tandem partners, what we call it, will solve worksheets in English. And this basically gives you an opportunity to teach someone English and to learn Czech and to also learn about different cultures and meet up with someone who's studying the same course in the same year, except in a different language, in a different parallel. I found them quite welcoming. I work with the university and the staff are extremely nice. At least everyone that I've come across with. Dr. Brisman has been my mentor since I was in my first and second year. And I've been working with him ever since. So I find the students, the community very nice. You just have to place yourself and be kind and be able to be accepting of different cultures and backgrounds. I know this is quite open for a lot of the students that are there in this call who are from Dubai, especially because we do have an international community there. So I would say they're welcoming in that sense. You just have to be open-minded yourself and respect, check customs. But really, it's an open country, and you're able to live freely here, and everyone respects everyone here. So
That's the
I've
thing.
definitely found
If I
that
go,
as
yeah, if I go to Dubai, when I go to Dubai, I have to respect the customs in the UAE, just as I expect anyone to
absolutely.
respect the customs in the Czech Republic, which is a secular country, and the Czechs are very staunchly secular. So the university is secular. It doesn't have churches or political groups inside the university, but freedom of religion is enshrined in law. So if someone asked a question about religion, yes, you can practice any religion you want as long as it's outside the confines of the university, because the university is secular because it wants to be open to everyone. So in Britain, we have universities, you'll have an Islamic society or a Catholic society or a conservative society or a Labour society. And we believe that's how we are inclusive. In the Czech Republic, they're saying we're inclusive by not having those groups in our institutions. But by law, you can, practice any religion you want. You can get halal products, you can get kosher products, etc., etc. The Czech Republic is a very, very kind of multicultural society that has a lot of provision for people's different beliefs and requirements. Now, someone asked about security at Charles. Do you feel safe? How do you feel in Prague? Prague is on the metrics one of the safest cities in the world, actually, especially compared to the places like London or Manchester or anywhere I live in the UK.
Well, Prague is very safe. I can quite compare it to Dubai, I would say, and I was born and I grew up in Dubai for 18 years. Of course, the security in Dubai is one of a kind, but I do feel quite similar in Prague. I'm able to walk around, and I have a lot of my friends that say that as a woman, they're also able to walk around at 4 o'clock in the morning in Prague and not really face any issues at all. You have the police force here, which is extremely strong. And if you were ever to visit our dean's building, you will see the police car parked outside with two massive police cars with police officers with their guns there. So we don't need this sort of security. It's a show. I will tell you that, because Prague and the Czech Republic is generally very safe. It is the safest country, in my opinion, in Europe. And I've traveled to many different countries across Europe. I've never heard of any sort of violent acts happening. Of course, there was an issue that happened last month, which is a one-off thing that's never happened in the history of Czech Republic or in Prague. But I feel extremely safe in this country, and I've never faced any issues, nor have my friends, in terms of security or safety here. There's no sort of violence with knives or guns or anything like that. Yeah.
I had a webinar, I had a call with a parent and a student in Australia the day. We pulled up the statistics of London versus Prague, and it was quite embarrassing for the UK when you see how many Greens were on the Prague list and the lack of on the London list. Someone's asked about the tuition fees. I'll just go through some things for now. The tuition fees at the moment are 600,000 Czech krona. That's about 24,000 euros a year, and there are some types of scholarships available, but they're not significant at the moment. If that changes, great. But as I said, on the presentation I gave before, there are so many other medical school options out there. We have everything from 11,000 euros upwards. People have asked questions about the exam. Sorry, you can't do the exam online. You have to turn up to one of the exam centres. If you're committed, you will do that. We had, and you've met him, Darren, one of our students who started at the first faculty this year from New Zealand. He actually travelled to Dubai, took the exam in Dubai from New Zealand, passed the exam, and is now at Prague. If you are motivated and you're committed to studying at the first faculty, you will find one of those exams, or you can fit into one of those exams, and you can do what it takes to get there. The interview is online, but the university requires you to sit the exam in person in line with its regulations. And related to A-level grades, which a lot of people have asked, it's not about your A-level grades. It's about the entrance exam. So if you pass the entrance exam, as long as you graduate with your 3 A-levels, then you can enroll at university. We're not looking for particular grades at IB or A-level or your other high school curriculum if you're taking APs, etc. So we've just coming up to 10 past. I think we'll give it 5 more minutes. Let me have a quick look at any other questions that have come in that's a bit different to what we've asked. Okay. There's no increase in the fees for the 6 years at Charles. It's fixed fees for the full 6 years. So don't worry, no one's going to hit you with more increase in fees at any point. For those of you that want to see the faculty, there have been some open days at different points, but if you want to do an individual visit, that's what most students and parents tend to do. As we've talked about before, Darren's exams generally are oral at the end of each module. And the interview, as we said on the presentation, to get in is an MMI, which we will prepare you for if you get through the exam. So let's have a quick look at a few of these other questions. On the entrance exam, important. The entrance exam can only be taken once per faculty per year. So if you take an exam for first faculty and you don't pass it at the first attempt, you can't retake it in that academic year, but you can then still take the entrance exams for the other faculties. And the entrance exams in London are taking place on the 20th of April, and then again on the 23rd of June. Details are all on the Medical Doorway website for all of our exams, as well as were mentioned earlier on in the presentation. So let me have a quick look. Okay. There's nothing significantly different than what we've had. Okay. Then, oh yeah. Talk about the groups, actually. Someone's asked about a ratio between applicants to people who get enrolled. You'd say about 8 to 1 applicants, but not everyone will accept the offer. Not everyone turns up for the exam. So I don't have the data beyond like 8 to 1, etc. Exam dates, medicaldoorway.com, click on exams. So if someone's asked a question about the exam dates, just go to medicaldoorway.com, click on exams, all the dates are there. Right. Important question I spotted before, and thanks again for reposting it because it's one I wanted to deal with. Anatomy lab sessions. I think one of the big strengths at the first faculty is anatomy teaching. David Sedmira, the old vice dean, a fantastic anatomist with a great sense of humour, got on with him very well. But you do have full body dissection, don't you? It's not just simulation.
Absolutely, absolutely.
Yeah.
So the simulations really start in your second year once you've gotten a little bit of an idea of physiology. But with anatomy dissections, already within 3 months of joining university, you will start with your dissections, right? And when I say your dissections, is we have 2 main courses of dissections. We have a winter dissection period and a summer dissection period, where in the winter, you're mainly focusing on the musculoskeletal system, and in the summer, you're mainly focusing on internal organs in the brain, the CNS. But regardless, every single week in your weekly anatomy classes, if I'm studying about the upper limb, I'm taken to the dissection lab. And after being explained about the different nerves and arteries and the brachial plexus and whatnot, different muscles that I have in my upper limb, by my professor and the teaching assistant, I'm taken to the dissection labs to view all of the different specimens on that topic, right? So every single week, I'm looking at specimens. I'm getting an explanation and a conversation with my professor and my teaching assistant. I have a test, and I have these big courses which do have an exam at the end of them in the winter as well as in the summer to focus on dissections even more. So absolutely, you are going to do dissections. You're going to be dealing with real patients and with, of course, different specimens. But within a few months of joining university, you're already going to deal with dissections with some basic anatomy knowledge.
We're going to sign off in a bit, but I want to go through 2 things. First, I'm going to share my screen and show people how to apply. And I've got one final question for Darren before we let him get back. Have you got any more exams this week, Darren?
I have oncology next week.
Okay, so we're going to leave you free in a minute. For those students that want to know how to apply, we've got the system on the Medical Doorway website, which is extremely intuitive and very straightforward to use. So let me just pull up the website. So at medicaldoorway.com, this is the website here, okay? And if you want to see where the exams are, you've got exams here, and all the exams are here throughout the thing. So you can see first faculty in Doha, first faculty in Dubai, and then we've got the other exams, and then we've got first faculty here in Hong Kong. For those that IB students, this exam takes place 1 week after the IB is finished. So it's great for those IB students who perhaps are in Asia, Southeast Asia. And this exam in Dubai takes place a week before the IB exams have started, and is important because of how long it takes to get a visa from the Middle East for the Czech Republic. And we have the London dates. But to apply, there's 2 ways to do it. You can either go to the little apply now button on the left-hand side of the screen, or you can go to the university page itself. And you'll see a blue button application form. And this is the bit where you can choose where to take your exams, okay? And if you say took them in the UK, you'll see that all the universities are listed there, and you just fill in this form and tick the universities that you want to apply to. Alternatively, if you were doing the exams in Dubai, let's go back to here, you'll see that there is a slightly different list of universities based on the exams that are taking place in Dubai. And again, you can simply choose the universities here you apply to. If you want to do dentistry, then second and third faculty don't have dentistry, they just have medicine, but you can choose the program here as well. It literally takes no more than 10 minutes to make an application on the Medical Doorway website. It's so easy to make the application, and then we will review the application before we send you the invoice for the university application fees and exam fees. All application fees get paid to the university. It's on the invoice. The exam fees simply cover the costs of the flights and accommodation of the examiners. Medical Doorway takes no profit from the exam at all. That's not how we operate. Our job is to make it cheaper and easier for you to apply, rather than use it as a way of generating revenue. Our service is paid by the university, okay? So please make the application. Even if you've got queries, we can come back to you on those queries once the application has come in, and then reshape things if we need to do it. The last question for you, Darren. What do you do in your spare time, if you've got any?
Well,
extracurricular experiences was the question, but I want to open up a bit more.
Well, I do generally keep myself very busy. I will tell you that. I spend my free time in my bed. I obviously with doing this work with the student organization as president, I teach. I mentioned that, so I teach physiology. So I teach second-year students, and I find this very fun because I feel like if you're able to teach a topic, you have to be better than someone that's learning it, of course. So that really gets you well versed with it. And then I also work with other organizations like LF1 Surgical Society, and I join a few of these calls as well. But I just want to say I'm super, I was honestly very shocked at the different aspects that you've created with Medical Doorway, because applying was not this easy for me. Let me just say that. Getting to the entrance exam, doing the entrance exam, getting the support for the entrance exam was not this easy, and a lot more expensive 5 years ago. And again, I'm just being honest with this. In my experience, it was quite difficult to get in without an agency that's there to support you, someone that has your back. And again, as Mr. Benjamin mentioned, they don't make any money from these exams, and you have nothing to lose by doing these exams. So definitely try. And also one of the reasons why I'm on this call is for the students, because if I take myself back 5 years ago, I never had a call or had the opportunity to speak to a medical student who's finished 5 years and is working with their student organization. I was always so, confused or blinded at the fact that at what I was going to expect, essentially. But I'm here for the students. I'm here to help you guys with any sort of questions. If you guys want a tour of our faculty, please reach out to Mr. Ben, and he'll pass on that information to me. We'll take care of you guys. If you come here in Prague, we'll give you guys a few workshops and yeah. Sorry.
Darren, how many people are in Medsoc? It's a big group you manage, isn't it?
It's huge. So we have our board. So we have a Medsoc board, which is with the president and the different heads of organization, and that's about 6 members. And the entire team themselves is around 100 people. So we have 6 or 7 different heads, and we have 100 people that work in these different departments in academic affairs or events or student support. So really, it's a huge bunch of students.
And if you want to get involved in sports or anything like that, the Czech Republic is a very active country. You can go skiing in the winter. You've got mountain and hill climbing in the summer. Football, the Czechs are football mad, ice hockey mad. There's so many, and I would say get involved in new things. If you come from the desert, get involved in ice hockey, get involved in skiing, do things that you perhaps have not done before. One of the things I'm going to finish off with, Darren, I think this is something which you touched on it earlier. Now, if you come from a country or you have a passport which requires a visa to travel in Europe, a Schengen visa, it's a golden opportunity, because for that 6 years, you've got a residency permit, which means you can travel across the whole Schengen area and actually see all of Europe in your holiday periods as well. And that's something which perhaps you wouldn't get if you studied in the UK or you stayed at home. So it does give you an opportunity, because once you're in your medical career, you're not going to have much chance to travel and see Paris, Madrid, Barcelona, Milan, Rome. Over that period, where have you been outside of Prague, on the basis that you can travel across the Schengen area visa-free?
Honestly, you really can't say this for many other universities. I think it's just because of where Czech is located. And you can't really say that a lot of medical students finish their exam and they spend the weekend in Italy. But this is what I do as well. You know, I finish my exam and I spend the weekend somewhere else. And I like to explore and travel. My sister's in Germany, so I visit her very often.
Yeah.
I've gone to Germany countless times. I've been to Austria, to Netherlands. I had a flight to Italy which got cancelled because it was snowing on the runway at the time. I was on the plane, but I've done my fair share of traveling. Also here in the Czech Republic, we have beautiful treks, and some skiing as well, which is amazing, which is really fun. But I would say probably Netherlands is my favorite country right now, and of course to the UK. But I would say Netherlands is my top country right now.
Yeah, but it is a fantastic opportunity. You can hop on a train and you get off in Dresden in 2
Absolutely.
hours, Berlin in 4. I think Vienna's about 2.5 hours away.
Yeah.
The train. You can fly to Paris in for like, sometimes you can get a flight for €20. It really, it does, it's a fantastic opportunity. And I think for those students who perhaps, especially if they're coming from Asia or the Middle East, if they've got an Indian passport or Nigerian passport or a passport that requires a visa for the Schengen period, you know, you can book your summer holiday on a Greek island and no one will actually be checking your visa as you go through or your passport because you've got that opportunity. And I think that's one of the other things which I think studying medicine in Europe, especially in the Schengen area, generally provides as an opportunity. Right, I'm going to say a huge thank you to Darren. We've gone over as I expected, but I want to say a huge thank you to Darren for giving us the time. A huge thank you for sacrificing your time and coming to Dubai with us in November and being at Gems World Academy for the event that we did there. And then we had a great time afterwards with all the universities. A huge thank you for that. We are all here, Darren, Medsoc, the faculty, Medical Doorway. We are actually here to support you, students, parents, school counsellors, to help you get access to the right medical programs. And please ask questions, get involved. As Darren will testify, we're here to support you. We're not here to kind of, you know, as many other agencies can do, to take money from your back pockets. That's not how Medical Doorway operates. We're here to make sure that we find the right medical school. And if medicine is the right pathway for you and Europe or Charles is the right pathway for you, we will help you maximize the chances of getting there. But I want to say a huge thank you to Darren, a huge thank you to everyone who's turned up today. The numbers were quite big, so I'm delighted for that. For those that want us to watch this again, our Medical Doorway on YouTube, you can see that there, as well as on our Facebook page. But apart from that, stay safe, and I hope to see many of you in the upcoming entrance exams in London, Dubai, Hong Kong, Doha, Sao Paulo, or Berlin. We're running a record number this year because of student demand, so we are going to be busy. And then hopefully we'll see you at enrollment in September of 2024. Thank you and have a great day, evening, wherever you are.